So, kind of going back to the misconceptions, something you said earlier that really resonated with me is a lot of people think type 2 diabetes is something you self inflicted and that, you through improper diet and exercise, you made yourself overweight and you brought up your blood sugars and everything. What do you say to people who say that to you? Like, is it really just genetic things that lead you to potentially be type 2 diabetic? Is that what you're looking at more?
It's a lot, very much so genetics. I think 30 to 40% of people's insulin resistance comes from their genes. And then, so that's a pretty large portion of it. The rest, a lot of the time, I don't think we consider stress enough. A lot of the people I see getting diagnosed with diabetes are actually often healthcare workers because we're working night shift. We're very stressed out. And
Yeah.
then there's this idea that America, we're seeing more diabetes and like it's because we're all fat and blah, blah. No, it's because we're all working constantly and very stressed out. There's no time to take care of yourself. And so we have all these cortisol levels rising and all these other hormones that are out of flux. And you can also get into possible endocrine disruptors like in microplastics and shenanigans that we have absolutely no control over. Could also play an effect in even triggering type 1, but also maybe promoting some insulin resistance. Medications also, if somebody is taking steroids for another disease, psychiatric medications a lot of the time cause a lot of insulin resistance and can lead to type 2 diabetes. And none of those are your fault at all. Like you're just trying to take care of yourself, get through life. And of course, there's a little bit of a nutrition component to it. And if you are a little bit more sedentary, it's going to definitely make things a little bit worse. But if we're looking at a pie chart, everybody acts like nutrition is 50% of it. And it's just not. It's like, it's a small slice of the pie. And then there's other small slices of the pie. So that's something I usually try to help people. It's not all based off of food or things that were really within your control. And even those things that maybe you consider are within your control, maybe you don't have access to foods that are a little bit more health supportive. Maybe you don't have the time to meal prep and you really do have to eat out more often. That's not necessarily that's not like a willpower thing or anything like that. So I think it's just totally ridiculous to blame anybody for it because there's just so many different factors that go into it and so many things that just aren't within our control.
I remember seeing this TED talk where this guy, Peter Attia, who's like a nutrition surgeon guy, talked about how he's a surgeon and he had to amputate somebody's leg due to diabetes. And at the time, he
Mhm.
had a lot of disdain for this person and was like, how did this person let themselves go? And he talked about, I was a surgeon, I was working out like 2 hours a day, eating healthy. And fast forward 2 years, I was pre diabetic. And he's
Mhm.
like, he said a light bulb clicked off and he started crying because he was like, I can't believe I ever treated that person that way. And he's like, there's so much more to it than we want to give credit for. He's like, I was the poster child of health and working out and all that. And it still happened to me. And I think not enough people understand all the factors that you mentioned because it could happen to anybody at any time. And it couldn't be due to just eating too many Big Macs or something like that,